So welcome everyone to our monthly Living Well with Cancer series, brought to you by the Cancer Resource Center of the Finger Lakes and Cayuga Medical Center Oncology Clinic. My name is Bert Scholl. I'm the Client Services Specialist at the Cancer Resource Center, and tonight's presenter is Dan Kress, Oncology Social Worker at Cayuga Medical Center. With that, Dan, I'm going to hand it off to you.
Thanks, Bert. Thank you, everybody. Again, I'm Dan. I'm the Oncology Social Worker, and I work every Wednesday and Thursday, and I also have a big team behind me. Typically, it's the oncology nurses, the nurse navigators, the physicians, the physician's assistants, nurse practitioners, the nurses, and the support staff and team. It's a really big team behind me, so I really appreciate them, and thank you. And some of them might chime in tonight about some of the good examples that they've experienced with triggers. And that's the purpose of this presentation, is the oncology and psychological triggers. And I'm focusing specifically on cancer and the treatment of cancer and all the issues that go around cancer treatment. Okay. So what we're going to review is trigger examples, what triggers you, how to identify triggers, which is really important, how to identify triggers, what signs, the common triggers you have, positive triggers as well, because they're not all negative, and all those kinds of process. I started thinking about this whole issue of triggers as a therapist, as well as a counselor, social worker, and a human being, about what triggers me, what triggers the patients and the family members, the support staff, also with the treatment team as well, because we all get triggered, So that was the purpose of this training, just to remind you about how triggers are and how to identify them, how to cope with them, how to manage them, what they are, and not to be so fearful of them. As long as you talk about how you're feeling and all those kinds of issues that we face the treatment of cancer. And if you have any questions, just let me know. I see there's okay. So the definition of a trigger is let me share this. Did I share the screen yet? No, let me share. I assume you all can see that. Is that correct?
Not yet.
Can you see it now?
Yep, here you go. It's about to pop up.
Okay.
Definition of a trigger. Beautiful. Thank you.
Great. Awesome. So again, the trigger is a stimulus that causes a painful memory to resurface, specifically when we're focusing on cancer. A trigger can be a sensory reminder, which is the key clause here, of a traumatic event, a sound, a sight, a smell, or a physical sensation, or even the time of day or the season. So often that can be part of the whole trigger process. Traumatic event, being diagnosed with cancer, or having to come into your physician's office and talk about maybe having cancer or what they might have found, blood tests, or it could be also, related to some a loved one that's been diagnosed with cancer. Okay. Trigger examples. Memories of the first diagnosis, when you're first diagnosed with cancer, or your family member was diagnosed with cancer, your loved one. Very serious. Memory of your first chemotherapy I'm often down in the infusion chemotherapy suite and watching and listening to the nurses review the chemotherapy process and what that means and how that works and how they're teaching you about what to expect. That can be very challenging at times. And when you're getting treatment and you're getting your chemotherapy and you're seeing another patient going through you can also have a trigger. It can be all sorts of responses. It can be a feeling, it can be a sight, a smell, taste. And the memory of your first chemotherapy treatment. That can be very challenging as well. Going into the room, getting into the recliner, having the nurse talk to you, the smells, the sights, the needles, the medications that are being put up looking at the medications going into your body, getting that first needle put into you when you're getting your chemotherapy that first time. And I'm assuming many of you can remember that. It can be very challenging. That can also be a fairly significant triggers. Does anybody have anything they'd like to add to that one? Trigger response. Again, the memory of the diagnosis when you first are diagnosed with cancer. The memory of the first chemotherapy teach. Having the nurse walk you through what you think you're going to expect or what you might expect. You really don't really know. I mean, they teach you how to, what you're going to go through, but then you start to experience that. And then the memory of your first chemotherapy treatment when you go. So those of you who are experiencing when you go for your infusions, and you see folks who are getting their first chemotherapy treatment or their first teach or, the first time they might be there, that can be also a major trigger for folks. So be aware of that. I'll get more details about the psychological response, but those are the typical responses for cancer treatment. Great. The other piece to the diagnosis as well is when you meet with the physician and they talk to you about your diagnosis and what your treatment plan might look like and how that's going to work. And then often after that's all completed, they talk with the nurse. She takes your blood pressure, and you might have some questions. And some of you might be really, your heart rate might be increasing, or you're really, you're really overwhelmed, and you haven't really heard what the doctor said, only that you have cancer. You're going to get treatment, and these are the, this is what we're going to do. This is how we can help you. And then they provide you with all sorts of information and some paper handouts. And you can connect with them on various other sites when it comes to the Nuna. That was, I think that's called the app. And then either Eileen or Renata comes in, or myself, and you have lots of questions, and we review what we're going to do and how we're going to take good care of you and how we're going to walk you through this and coach you and all those kinds of challenges that you're going to be facing moving forward. Has anybody ever had those kinds of experience before in this audience? No. Okay.
Sure.
So what?
This whole conversation reminded me of when I get saline injections. I can still get nauseous from the smell of saline because it reminds me of like the chemo's coming.
Yeah.
That's right. That's correct. Yeah.
I didn't have a lot of reactions to the chemo or the treatment or anything, but I noticed other people, really got sick. They did not want it. And I think that's what I thought, of like one woman in particular. I don't know who she was or anything. She was I didn't go to CMC, but she was there in the area, and she was like, oh, she was telling about all these symptoms, that she was having, and she just didn't really want it that day, She didn't want the chemo that day. That's how I looked at it, When I got diagnosed, I just knew I'd have to go through a whole lot of stuff, that I wouldn't normally go through if I didn't have cancer, I had breast cancer twice, and I went through chemo twice. So they were very different both times. And I don't know, I just really thought I was going to make it through. This was just a terrible inconvenience. It's kind of stupid, but I don't recall any specific triggers, except for now that I'm through it and I'm in remission. I mean, we just know there's no more cancer,
Awesome.
there. I'm going through these doctor's appointments still, and I think they're harder on me than when I was actually going through chemo and stuff. It's just like, why do I have to keep going or something? It's like I'm really tired of the cancer scene. But I think this year's follow-up appointment, it was 6 years since I had my surgery. It's like the 2-year appointments, the 1-year appointments, and the 6-year appointments all happening in the same month. And I'm like, I was really set back by that. I don't know if that's traumatic or not. I mean, totally good reports and everything, but just having to go to the doctor's office for any reason, I guess. So many doctors all in one short period of time, I kind of was like, set back by it. I thought, I got negative, I think. So that I don't know, it was more traumatic than the diagnosis or the treatment, because I'm that kind of person that I see this mountain and I get my shovel. So, but incidental appointments, even though it was like 10 appointments in a month and a half, it set me back for some reason, even though it was all good reports. So funny, more so than the treatment, more so than the diagnosis. Yeah. And now I'm kind of wondering, when am I going to get it again? So there I am.
You got through it. Fatigue. It's overwhelming. All the doctor's appointment creates a fatigue, doesn't it?
I think it was a lot
Mhm.
of it was fatigue, and it still is. I'm just
Mhm.
overtired or something. Yeah.
Well, that's a recalling of. That's a trigger too, you know?
Yeah.
It is, yeah.
Okay.
Speaking of what triggers you, Bert was talking about the smell. So when you get your shot, Bert, what happens?
Me?
No, I was talking to Bert.
Oh, Bert.
Yeah.
I'll get a CT scan, right, and they'll inject a little saline in me, and there's just this kind of spark of, like, I don't know if it's a memory of nausea or just a little spark of nausea. It doesn't stay,
Mhm.
but it's always something in the throat where it's just like, oh gosh. And
Right.
then my body, which seems to hold the memory, remembers that this is, or knows this is not what's happening right now.
Mm-mm. Classic trigger though.
Oh my goodness,
It
amazing.
really is. Classic. Classic. And the sight of, that's another trigger, right? The sight of the room, the sight of going to the doctor's office. The other person was talking about having to go to all these doctor's appointments all at the same time. It's a bit overwhelming. The sight, the sound, the recalling of, right? Recalling of a treatment, and the feelings. What are the feelings, right? That's a big piece of this as well. People come into a doctor's office, and they've had treatment, they're in remission, they've had their scans, they're not really sure what's going to be seen or discussed. Does the cancer come back? Is it remission? And they start to have all these feelings. Their heart races a bit. Their mouth might get dry. They might be saying things to themselves like, "Oh no, here I go again. I'm really worried." Get tearful, get nauseous, agitated. A little agitated. We see that a lot here too. Of course, they're going to get agitated. They're back at the doctor's office again, or they're seeing one of the physicians. So it's the smell, the sight, the sound, the recalling of, and the feeling. Lots of different triggers. And sometimes it all comes back at the same time. It's overwhelming. But we have some ideas about how to take good care of yourself, while you're in the doctor's office or before you get there. So, anybody have any questions about that? Let's see here. How to identify triggers, types of triggers. Is the external piece here first. Is the people, it could be the providers, the places, it could be the doctor's office or the chemotherapy room or the drive up to the centers, depending on where you're getting your treatment. And the things that go with all of that. People, places, and things. All that stuff that goes with the folks. And then there's the internal process, which is the thoughts and feelings. And that's the piece where It's very challenging for most human beings, when they start to think about different kinds of issues. Am I in remission? It's not what people tell you, what you tell yourself before you get to the physician's office. You start having all these ideas. You start to feel really anxious, and you start thinking all the negative thoughts. Or as you could be thinking about, your treatment and how it went and how it's going. And, now I have to see the doctor again. And here comes the nurse with the IV bag. And, when you look up and you take a look at what's being put into your IV and how that all works. Very difficult. The thoughts. And sometimes they can be very lonely, especially if you're there by yourself, or even if you're with a caretaker. You still have those internal thoughts going through, and then you start to feel things. What do you feel? How do you feel about those issues? Do you feel sad? Do you feel anxious? Do you feel agitated? Do you feel overwhelmed? Do you feel that sense of fatigue? Here we go again. Or on the other hand, what could be your last treatment, and you're getting ready, you're done, you're nearing the end, and that thought can be positive. So it doesn't always have to be all negative. It can be really exciting as well. And relief, a lot of relief goes into that. So again, the internal piece. Then it's the synthetic, which is a specific senses, like smelling popcorn, that reminds you of the movie theater. That's what we're referring to when you smell something or you taste something. The smell can be a bit of a challenge. It's another trigger that triggers folks, and we see it a lot when we're down when we're down in the suite. At least I do. People will be quite silent. They might be really quiet in their own thoughts. They might be watching TV, but yet they can be experiencing all these different kind of external, internal, and synthetic responses. And often they sometimes don't talk about it. So our team, we're aware of most of these triggers, will intervene, check in with them. How are you doing? You seem quiet. Right? What's happening? So it's really important to do that, to check in with folks, especially if you're a caretaker. Any of the folks that come in with people who are being treated and they're one of the caretakers, they too can experience all of these different kinds of triggers, especially when it comes to the caretaker fatigue syndrome, So very challenging. Any questions?
Dan, I just want to chime in and say that right now the screen you're sharing is me and then a panel across the top.
Oh, okay. Let me see here. Huh. That's weird. Okay, let me see. Can you see it now?
Might take a moment. Right now it's still me and
It says your screen. It says your screen.
Yeah, it doesn't look right. Something's wrong. Oh, no, it's me.
Oh, okay. Let me see again. It's right here.
now we're back to
Now we're back to speaker.
You got it? You got it? Okay. It's interesting.
There you
Okay.
are. Beautiful.
There you go. Right there, you can take a look at it. Any questions?
This fatigue thing, when I think of fatigue, like the fatigue that experiencing, I'm wondering, is this kind of like battle fatigue?
Yeah, it can be.
Is it similar?
Yes, totally. Mm-hmm.
Yeah.
Fatigue comes in all sorts of ways, especially psychological fatigue.
I don't. And I've had psychological fatigue, but I don't identify with that with this for some reason.
Okay.
I've been trying to keep my head and together, and try not to have too much chemo brain by learning new things and reading and doing things that keep me from forgetting and things like that chemo brain is. I don't think I suffered too much. I don't know, maybe I'm probably wrong, but I don't think I suffered too much from chemo brain, but it's just general fatigue and being overtired, physical, and I'm like chemical kind of fatigue. It's not so psychological. I don't know.
Well, it sounds like you practice a lot of mindfulness coping skills.
Yeah, the groups help a lot. The
Right.
support groups. Yeah.
That's right. There you go.
Hi, this is
Caretaker
Betty.
fatigue. Mhm.
Oh.
Hey, Betty.
Hi, I just wanted to address the fatigue. It definitely is is something that folks experience, during and even after treatment. And, there's been clinical research done that, a little exercise can help with fatigue. I know it's hard to tell someone to get up off the couch and take a 10-minute walk when they're so tired, but physical activity actually can help fatigue. It's something you may want to talk to your doctor about a little bit more of what other things you can do to help address it.
Yeah,
Because
I
it
have
is
tried
it
that.
is real.
Yeah, I have tried that. I am doing the physical part. Yeah, the exercise. And
Oh.
I've got to do it more regularly, I suppose, like right first thing in the morning, etc. I
Well,
suppose.
that's great.
Yeah, it does help. It does help. But I found since chemo, because I used to be very athletic, since chemo, even the first time in 2004 or 5, I it's easier to get worn out. I don't have to do as much exercise as I used to. I mean to get worn out. I get worn out easier from exercise because exercise can be tiring. So I can't do the exercise I used to be able to do before chemo. But a little goes a long way, that's for sure.
It does. Get up, get moving, get rolling. Get up, get moving, get rolling. Stay off the couch. Another example of an external trigger is getting to the facility itself. Getting into the car. Some people take the bus. Some people have to take a cab. That can be a bit of a challenge as well. And it's a trigger for sure because you have to get ready. You feel tired. You have to get up. You got to get all that energy going. You got to get out to the car or out to the cab or out to the bus. Then you have to get to the facility. Some of you can walk. Some folks have to use a wheelchair. Some folks might need a walker. That external process can be really challenging. And of course, there's an internal thinking, can I get there? Am I going to be able to do this again today? Here we go. Feeling overwhelmed, feeling exhausted, or feeling relieved that you got there.
Dan, there's a question in the chat for you.
Yeah,
Okay,
I
great.
saw that.
Okay, great.
So there's a number, depending on where you're from, when it comes to finding a provider to work with, I can, or what can I do? Can I send a list to you of all the providers in the area, including all the surrounding counties? Would that help?
Absolutely.
Why don't I do that? I
Sure.
don't know where this person's from, so if they're from the Tompkins County area, there's a number of providers in the area. Many of the providers have moved. There's a question about finding providers and therapists in the community. There's a long wait list, of course. I'll just zip through this a little bit quickly because it's often folks forget that if you're gainfully employed, if you're employed and you have an employee assistance program, which is an EAP, there's a 800 number usually or another kind of phone number that manages these kinds of calls. You're more likely, it's quicker for you to get in to see a provider because there's a requirement under their contracts to get you in within typically 72 hours or less. And their job is to find a provider network for you. And typically there's no cost to you. Some of the sessions are 3 sessions, some are 6, some are 8. It all depends on your employer. So be aware of that. Often people are employed at this time, even when they're getting treated, sometimes forget about their employee assistance program. It's a really quick way to get in to see a certified or licensed provider. Most communities have family service programs. They call them family services or family services society in the counties. You can, if you have a computer, you can always Google that, the name and the numbers, but also they'll have the phone numbers as well, and they have websites these days. Many of the providers have moved to telehealth, similar to what we're doing right now, so it's not so difficult to get to the provider. You can see them on the screen and have some counseling services over there. The other challenge for people in getting treated, and including family members and caretakers, is the cost of the providers. And do you have the insurance that covers it, or is it a fee for service? They'll let you know right up front about how that works. And then there's lots of private providers. Sometimes they take insurance, and often they don't. So it's a fee for service. It depends on the cost, and sometimes it's a sliding scale. But I think really about I believe the average cost of a therapy session, if you're paying out of pocket, is about between $100 and $150 a session. It depends. So I will send that information to Bert. When would you like that, Bert? Send it this week.
Sure, that would be great. That would be great.
Right.
And then I can add it to my list as well.
Okay, yeah. And about the providers, this is not just a local issue, it's a national issue. The wait time is quite long, very long, very long. So it could be 1 month to 3 to 4 to 5 to 6 months. It depends. That's the way it is. It's really a bummer, but and I'm a provider. My office where I work, our average wait list right now is out to 3 to 6 months. So it's a bit of a challenge. So.
Wow.
There's lots of us doing it. Yeah. Talk about the kids too. So lots of people waiting for counseling. Here, I see patients directly down in the chemotherapy rooms, exam rooms, or I'm always checking in on them. So if you see me, don't hesitate to ask me if you want to chat. If you're in Cayuga Medical, I also cover the East Side, Schuyler County, Cortland. Am I missing someplace? I think that's it, right? For now. So it's So the east side of the East Side Clinic, the Cortland Clinic, Schuyler Clinic, in here at this time.
This is all just the past year you're doing all these places?
Yep.
Oh,
Yeah.
wow.
Yeah.
And
Yeah.
prior to this, where were you? And was this your specialization all along, the cancer?
Well, I've worked in healthcare since I was in my early 20s. So,
yeah, but I wondered if you were.
This is my first clinic. Yeah, I've never worked in a.
It's great.
Oncology.
Good for you. Yeah, that's very challenging.
Yeah, but I have a great team. I work with a really good team. It's not just me. That makes my life a lot easier.
Yeah.
I have the oncology nurses, the nurse navigators, which is Renata and Eileen.
Yes.
Right, and I have all the nurses. They all know who I am, and then all the providers and all the doctors, nurse practitioners and physician's assistants, and everything's done behind the scenes. So they let me know if there's somebody having a really difficult time, and we swoop in and work with them.
Right.
All of us. Often the nurse navigators, there's 3 of us. That's a really specific team here, but we often go in together and work with the patient, that's first diagnosis or struggling, or there's issues with the family system, or lack of services. And one of the huge challenges for the nurse navigating team is transportation and the challenges and the costs. So they work directly with the patients as well. So there's lots of different moving parts to the treatment the treatment process, and dealing with all these triggers that go with being diagnosed with cancer.
Hey Dan, it's Eileen. Can you say something or help with a little bit of the reaction and a trigger of people who tend to be avoid discussion or kind of try to block it out? Is it best to not approach and try to help them express their feelings, or is it best to leave it alone?
Well, as you know, we've seen that your first diagnosis, you're a deer in the headlight, right? What? The patient hears is I have cancer. And of course, the first thing they think is what? What's going to happen to them, right? And if they're by themselves, it's hopeful that's where you and I often, including Renata, we reassure them that they're not alone, and this is your treatment plan. Because most folks, when they hear that first diagnosis, what's the first thing they think of? I'm going to what? It's going to kill me.
Yeah, they think they're going to die.
They're going to die. Yeah, we see that a lot. Especially with women with breast cancer. They just want to, including men, all of us, but we just want to get that cancer out of us. That's and then if there's a panic that sets in, it's a real trigger. Heart races. They get really, anxious. Typically, what I do, Eileen, and I think most of us do, we just sort of have to check the temperature of the patient to see how they're coping, and not press too hard, because we really want to see where they're at, because they are going to come back. And also we follow up with phone calls. So often Eileen or Renata will say, hey, Dan, can you give so-and-so a call? They're very quiet. We've seen this many times. They're kind of silent. No one's saying anything. So could you check in with them? Sometimes on the phone, it's a little bit easier for them to talk. Or 24 hours to 72 hours later, they've absorbed some of the information, and then they can talk. But they're going to come back, hopefully. They'll come back for their treatment. And we see lots of people who get very anxious and nervous about coming back because they're so worried, so scared. And sometimes that's where the cancellation starts, and they don't want to come back. And we, as a team, work with them, and we get them back in here and get them treated, because they are going to get better. They really are. So does that answer your question, Eileen?
Yeah, thank you. Just, we've worked hand in hand on some cases. It's just some of the, sometimes when people don't want to talk, it's certainly respected, but
Yes.
just wondering if there's another way, or anything else that we can do. And also, I think the navigation team works very hard to really get to know our patients very personally. I feel like I personally use a lot of distraction. I know that one thing about the person that I can bring up, whether it's the joy of their grandchildren or what their hobbies are, and I tend to focus on that when I do have those conversations, as well as you're helping with whatever issue, whether it be a referral or transportation. But then I always try to remember, and I think Renata is the same. We try to remember a little something about that person to try to kind of distract from it. So it's not all talk about cancer, that we know you as a person and we care about what else is going on in your life.
Agreed. Okay, the next screen, I'm waiting for it to move over. It's a little slow.
That's all right. This is a great presentation.
There you go. Can you see it? What are the signs of triggers?
Yes.
Okay, great. So this is what we're also focusing on with the trigger response, right? What are the signs of the triggers? So it's the emotional response. I just talked about it. Some people are quiet and silent, and they don't really want to talk about it. They need to process all this information. Or the person is remembering when their grandparent might have been diagnosed with cancer, or other family members are diagnosed with cancer many years ago. That's a big challenge that we face here with the triggers or the emotional response, because what happened 10 to 15 to 20 years ago related to the treatment of cancer certainly has changed for today. I don't know if anybody would disagree with that, but we have seen so many changes, better changes, more responsible changes.
Yeah, it's Renata, Dan. I just wanted to input in. I mean, I think cancer compared to what cancer used to be. Sorry, I'm one of the navigators for anybody that does not know. And I think just cancer, it used to be almost like you said, people instantly thought of death, as opposed to cancer now really is thought of as more of a chronic illness, more of an illness just like diabetes or heart disease, and
Right.
much more manageable. But it still holds a huge stigmatism for people, that really associates a negative outcome. And that's not
Right.
always the case. And I think it's a whole different mindset from where cancer treatment was, and where cancer, even in the last 15 years, even kind of really thought more of a chronic illness and something that you maintain and get to a surveillance stage and things like that. And as opposed to, well, for lack of better terms, a death sentence, or, immediately thinking of death when you're diagnosed. But it's hard as human nature, I think, from sitting with many people that are newly diagnosed, very hard to not have your mind go there. And, Dan and us navigators work very closely together. And the physicians, I feel like, are very good at also kind of identifying when there is a patient that really is struggling, to kind of to help, and whether it be a trigger of new diagnosis or whatever. But I do think, like you said, cancer diagnosis is just completely different now. It's really thought of, there's a lot more treatments every day. There's new treatments. It's a different mentality. And I think to get the whole society and community and everybody to sort of shift that mindset over of, how are we going to manage this disease? I mean, if you went into a doctor's office and somebody said you had diabetes, you don't think immediately you're going to die. You think, how are we going to manage the disease? And it's kind of a different mindset. And I think sometimes just even shedding a little light on that can help, so it doesn't trigger people. Just some experience that I've seen, or just something I have found helpful along the way.
Right on. Totally agree. When I first entered the healthcare 100 years ago, seems like it was yesterday. There was maybe one doctor. There might be one physician. We didn't have all of the, the team that we have now. And when it comes to treating patients with cancer, so it's completely changed in a really positive way. We also didn't have the Cancer Resource Center as well. How long you've been around, Bert, the CRC? How long?
The
Cancer Resource Center.
CRC itself, of Cancer Research Center proper, has been around since 2007. And it was in the late 90s when the Ithaca Breast Cancer Alliance came around, but then they expanded, and so yeah, it's been, the whole organization, they're going on 30 years, but the Cancer Research Center being available for all clients, that's been what's the math on 2007? 16 years.
Yeah. So before that, there was none, so now we have it. We have this. We didn't have that before, which is really, really important, especially when it comes to training. And then there's the physical response to these triggers too. So, you find out you have cancer, then you have this physical response, all the physical process, you feel nauseous, maybe a dry mouth, heart starts to increase, you start to sweat, you start to tense up. That's a complete trigger. And then, of course, there's a taste response. Now, this is a real challenging area too when it comes to triggers. When people get, generally speaking, when people get agitated or irritated, or they're frightened, sometimes they get a dry mouth, or sometimes they get a metallic taste in their mouth. We see that often. That's a normal, well, I'll use the word normal, but that's a physiological response to, a trigger. Not unusual. So. And of course, is the visual responses. What people look like. They flush. They start to flush. Tearful, all that stuff. Look around. It can be very challenging. So be aware of all this. Of course, we're aware of all this, and there's a couple of things you can do. So I'd like to walk us through. Does anybody have questions about that? What the signs of triggers are? I think so. I think all human beings, maybe. I believe all human beings have triggers because we're human. That's just the way it works. So we all just to be aware of these triggers and how to cope with them. So I'd like to talk briefly about some coping with these triggers, if I could. And you can Google all these. I'm not a big Dr. Google fan, by the way. I really don't like Dr. Google. Sometimes that can be difficult and cause all sorts of triggers for us. But the positive approach is what we call the 3 R's. Have you heard of the 3 R's? To the mindfulness coping skills? Anybody? Okay. So the first one is recognize. So you recognize how you're feeling, recognizing that you're feeling anxious, sad, overwhelmed, or happy, content, excited. And then there's the release part. That's when you start to hold things in. The goal is not to hold things in because you want to release it. And of course, you want to refocus. So those are the 3 R's. So recognize how you're feeling, take a pause, take a deep breath, look around, let it go by breathing, a nice deep breath and, blow out. Nice. Those of you who are into yoga and breathing and breath and breath training, that's really helpful for folks because we tend to, keep things in. We want to let it go. And of course, you want to refocus your attention. You want to refocus your attention. Look around, take a look, take another breath. Nobody's going to know you're doing this. You can do this and no one's going to know. It's a training. I do it every day. When I leave here, I have to really refocus because I don't want to bring any of that energy out to my car with me. Does that make sense? That's a mindfulness process. When I'm seeing somebody who's really struggling, and I think probably all my colleagues can attest to this, the goal is not to bring it home with you because there's nothing I can do. So what I do is, I give myself until I get outside. And if I'm still thinking about, that response from the patient and how difficult things are, and I think, look around, I look around, my gosh, we live in such a beautiful place, right? Look at the trees. Last week I saw a bald eagle. I thought that was a sign, like, yes, okay, we're good. So those are the things that you can do. So that's what we call the 3 R's. Then there's the 3-3 rule. Have you heard of the 3-3 rule? It's another mindful exercise. So, overwhelmed, you're anxious, you're home alone, or you're home. So the first thing you can do is you can look at 3 different things on your wall. It could be a photograph, a painting, could be some antlers on the wall. It could be anything. But that's what you want to do. Take a look at each one. When you look at the first painting, take a deep breath, thinking, wow, that's beautiful. Look outside. Wow, that's amazing. Take a deep breath. Look at the antlers. Those of you who are hunters, yeah, I did that, that kind of thing. So that's that first response. So that's one of the 3 things you can take a look. Then you can name 3 things while you're looking at them. Oh, okay, there's that antler. I remember that deer, if you're a deer hunter, right? Oh, there's my bird. Oh, okay, I see my bird out there, right? Could be the cardinal. Take a deep breath. Oh, there's my favorite photograph. Take a deep breath. You can do this also in office settings, by the way, too. Simply by walking through a door and taking a deep breath and looking around. Again, working here at the clinic, I can look outside. I often really encourage our nurses down there, and oncology nurses who are sitting by their computer a lot or working with patients, to take a moment, right? To take the 3 R's and take a moment to look outside. So if you see some of the nurses, and hopefully they're doing it because I'm always watching them, take a moment, often we'll say step away from the computer, take a look outside, look at those colors, take a moment, breathe, take it in. And then also there's another process where you can move 3 parts of your body. Now, those of you who are, if you're in treatment, you're really being challenged by moving your body parts different, it might be more difficult. But you can still move your legs or your fingers or your arms, your head. If you can get up and stretch, and this is the part that Betty was talking about, which is really important, is get up, get moving, get rolling, get off that couch. If you can walk, to the kitchen, if you're able to get out to the deck, if you can walk outside, even if you're having a day when you just are really struggling to get off that couch, really difficult. If you can just stand up and move around a little bit and take some deep breaths in between each movement. It's really important. So that's what we call the 3 R's. And that's a mindfulness process. And you have to practice it every day. And often it's challenging because there are some days you're just not going to want to do it. It's a real challenge. Does anybody have any questions about that?
Could you just do the bullet points again of the 3 R's, exactly what they are? I don't see them on the screen. So
I did. Yeah, I forgot to put them on. I forgot to put that down. So I'll send them to you. My apologies.
But which are they?
It's to recognize, release, and refocus. That's the 3 R's. When you look, you can Google them. It's called the 3 R's under mindfulness coping skills. 3 R's.
Thank you.
And then when you do the 3-3-3 rule, this is a therapy process. That'll come right up. You'll see that, and it's all about the mindfulness coping skills. And then you're going to see a whole host of other kinds of exercises you can do. But I didn't want to go into details about all of them because it's a little bit daunting at times. I'm trying to keep this simple, because most of us are sometimes we get really lazy and we don't think it's going to work. And you'll think, oh, that Dan Kress said, all I have to do is look at a painting. I'll be good. Well, Dan Kress is saying, take a look at the painting, because there's memories behind that painting, and take a deep breath and think, oh, that's really nice. Take a look at the antlers on the wall. Oh, that was a beautiful walk that day. Take a look at outside. Look where I am. I'm lucky. And take a deep breath. But we have to practice it daily, especially when you're in treatment and you're all by yourself, in your brain, in your mind. Okay. Any questions? Okay. The most common triggers, this is the one that we see a lot here, of course, is the doctor's office. Patients are coming in. I see them when in the reception. I'm focusing on the clinics right now, but not the doctor's office, but the clinics here, or the east side, or any of your clinics where you go to get when you're going to see the physician. You've got some news. He or she has some information for you, whatever the appointment's about. But when you go into the waiting room and you're seeing all these other people, right, that can be a major trigger, right? Because everybody there is there for basically the same reason. The majority of the people have some form of cancer, right? So that's a trigger. So be aware of that. It also could be helpful if you start talking about your cancer and how you're feeling about this, because I've seen a lot of people in the waiting room start talking about all sorts of different things and start to feel, oh, I'm not dealing with feeling anxious. I'm not dealing with feeling overwhelmed. That's important. We recommend that you don't. I know you all do it, but Dr. Google can create all sorts of anxiety for you, because it goes down to all sorts of holes, places that say things, you see some of the worst diagnosis, what could happen, the treatments, the medications. It's daunting. How about you, Bert? What do you think about Dr. Google? What's your thoughts about it?
I think that Dr. Google can take us to a very dark and scary place very quickly. You can search a hangnail and you can find it to have your mortality,
Right.
before you. It's
terrible. Yeah.
I don't recommend it.
No, but people have already done it by the time we see them, right? So.
Pardon?
Often people have already Dr. Googled everything, and then they've got all these terrible ideas in their mind, and then they come and see the doctor. I'm like, no, that's not true. That's not going to happen. Oh no, that's not you. That kind of thing. The list is long.
In my first diagnosis, I Googled a lot, and ultimately wasn't helpful. My second diagnosis, I didn't even look at Google. I just listened to my doctor, and I was like, whatever you say, I trust you. I'm not going there. Yeah.
We all relapse. The other night, can I give this example?
Please.
I had some dental treatment done, just a typical cleaning, and my tooth was all red. So this is what I did. I did exactly what I'm telling you not to do. I Googled, red gum. Suddenly, Google was telling me that I have sepsis. I should get to the hospital. I got 3 days to live. That goes on. I'm thinking, Dan, you should know better. Why did you do that? All you had to do is rinse your mouth with salt water. You're good to go. Just so we all go there.
Yeah. True, maybe.
I do think some sites are better than others, and there are National Institute of Health, Cleveland Clinic. There are some really good sources of information.
Right. Websites.
Yeah.
Healthcare websites, right?
Yeah.
Right. Yeah. That's correct. I agree with that. However, the challenge is do you know what you're looking at and what you're reading, and how do you interpret that information? That's when it gets really overwhelming. And does that help you with your treatment and your anxiety? Some people have to have all the information, that helps them, but it's a I don't know. And then there's the families of friends that have been diagnosed or have died from cancer. That's a major trigger for folks. Again, they're going back, as Renata was talking about, years and years ago, when the treatments were limited or different, and now there's all these different kinds of treatment approaches. Not to say that cancer is any easier than it was 50, 60 years ago, but the treatments have definitely changed. The other piece about this, this last phrase about families of friends, they will often, and I know they will come to you and tell you about all sorts of things they've Googled, or have you tried this? If you eat more kale, you know, you're going to get better. They'll have all sorts of ideas for you. Typically, and I can hear it in the treatment team room, in the treatment rooms. You know, they're focusing on all these different kinds of approaches and telling the, you know, the patients, oh, you know, you don't really want to get chemo. Have you tried this? You should try that. You know, that can be very, very difficult for the patient who's getting chemotherapy because, you know, they're the ones facing it. I believe most people say bring this kind of information to them because because of their own anxiety, because they're all worried about also getting diagnosed with cancer. That they don't know what to say. So a good phrase I tell patients to use with family members or friends who are providing all this information is, "Thanks, I got this." That cuts them right off. Because that amount of information is a bit daunting and overwhelming at times. When you're sitting there and you're getting chemotherapy and you're not feeling well. So, just a thought there. And we're nearing towards the end. Positive triggers. When I've completed treatment, I think there's a member here talked about completing her treatment after several breast cancer treatments, I believe. Good times, right? Relieved. Ringing the bell. Did you ring the bell? I don't know. Did you ring the bell? I don't remember. I don't know what your name is.
Patricia, what? So,
Patricia, did you ring the bell? Was there a bell when you were done with your treatment?
no, I didn't go to CMC for treatment.
That's a national, the bell ringing.
Oh, I don't know. I don't know. Never heard of that.
Does anybody know about the bell, where that came from? I was trying to look that up, but any of the Renata or Eileen?
I don't know the origin.
What's
Yeah, I
about?
don't know the origin either.
That would probably be Betty.
Oh, okay. Okay. I don't think is she still on? No, I don't know. Okay.
Yeah, looks like she is.
All right. Well, and then taking my first, and then, you know, another positive trigger is that when you're done, you take your first trip, or you're going to see your grandkids, or you're going to go see your kids play baseball, and you don't have to worry, you know, about being in treatment, or, you know, you're all these different things that you were down your list that you can do. Those are all positive triggers. Very exciting, you know, lots of positive stuff too. It's not all doom and gloom. You know, when you smell popcorn, what's the first thing you think of? You know, I think of a movie theater. That goes right back to that, you know.
Mm.
Okay, I have your bell ringing answer if you want it.
Yes, where is the bell?
It says almost 30 years ago, MD Anderson, which is in Texas, began implementing the bell ringing ceremony at the end of a patient's radiation therapy treatment, adopted from the Navy's tradition of ringing the bell after completing a task that went well.
Oh, okay. Thank you, Eileen.
Mm-hmm.
Yeah,
Awesome.
thanks. This is Betty. I found it as well. And I think that, you know, in past time, it was always, you know, that people who rang the bell were from curative treatment. But in more current times, I think anyone that completes any course of treatment, it's a task that's been achieved. So people ring the bell at that time too.
Okay.
Yeah, we've been discussing that, Betty, as far as if somebody feels that they had, that was brought up, I think survivorship, meaning bringing up that if someone just felt they were doing well, that it was appropriate to ring the bell.
Yeah,
They wanted to.
Yeah,
Totally
absolutely. I need to sign off, but I wanted to thank you, Dan, for wonderful information and the rest of the group. Thank you so much, Bert, for hosting this. I appreciate it, and everyone for all that they do, and all of our patients and all of our community members.
You got it.
Thank you, Betty.
Ready?
Thank
Welcome
you.
back.
All right.
And that's it. Anybody have any questions? It's almost 6:30.
I don't have a question, but I will say the ringing of the bell is a pretty great thing. Because it can, like myself, I'm not really a bell ringing guy, if that makes it. You know, it's not something I do, right? But then it dawned on me that there are people in the room, they hear that bell ring and, it gives them, they can feel hopeful and be like, yeah, we're doing this. People are doing this, And
Yes.
so that had me ring the bell. And then to my surprise, it felt kind of nice.
I'm glad you were able to do that, Bert.
Yeah,
I
thanks,
really
buddy.
am. I really am. So I will be sending you a list of providers in well, I guess I'll have to do like maybe the 5 county areas. So I'll send that to you for the people that are interested in providers. I don't, there are a few people out there that work with people who have cancer and other healthcare challenges, but that's fairly limited, but I'll try to ask for them next to their names. And what else was I going to do? And I'll send the information about the 3 R's and the mindfulness coping skills too as well. And well, we've been talking really basically about feelings, so that's about cognitive behavioral treatment, but we don't have enough time to get into that. So
Thank you. And again, I want to remind everyone, if you have a question that you don't want recorded and then available for the world to see, you just let me know and I will stop recording and you can ask that question. Otherwise, we can wrap up. And,
so just remember that triggers are workable. Just talk about them. If you're coming into your treatment and you're feeling anxious, let anybody know. Anybody know that what you're feeling and what you're thinking and what the examples are so they can help you out. Don't hold it inside. If you don't want to talk to anybody, look outside the window, look around, take a deep breath, focus on bringing it down, trying to chill out a bit when you're feeling overwhelmed. Or let your person who's with you, your caretaker or your partner, whomever, let them know what you're feeling or thinking. And also the people that are with you who are taking good care of you or supporting you, make sure we check in with them as well, because often they also face this as well. Sometimes they just don't know what to say or do, and they often hold things in because they don't want to worry you, but that's not going to help you either. So be aware of all that. So it's a team approach, not just an individual. We're all there for you. Take care of yourself. Sending out good vibes. Thank you.
Thank you, Daniel. That was great.
Thanks, Dan.
It's important to reach out when you're going through cancer treatment and even afterwards.
Yeah.
Yeah, Dan, thank you. And thank you, Eileen or Renata. And of course,
Thank
Betty,
you.
sorry, left for joining us and chipping in. We super appreciate it.
And good luck with everything.
All right.
Thank you.
Great night. Yeah, thank you for joining us. And we'll see you hopefully next month for the next Living Well with Cancer presentation. Have a great night. Bye-bye.
Have a good night. Thank you.
You're welcome.
All right.
Thank you.
Great night. Yeah, thank you for joining us. And we'll see you hopefully next month for the next Living Well with Cancer presentation. Have a great night.